It was just very informal. So we're gonna give our story to you guys. If you have questions, comments, concerns of your own, especially about certain parts of the stories or things that you sort of feel like you bonded with, or that you might one day be in that same situation, interrupt us, ask us questions. That's what today is for. So this is kind of all about us just sharing what we've been through and then hopefully giving you some of our knowledge that we're not sure that we have.
So we have like 4 hours for this, right?
Yes, so I'll just start, right? You might have to actually like put a red signal up for me to stop talking, because I really enjoy talking and having attention at all times. So I went to vet school at LSU. I grew up in the South and I went to vet school at LSU. So I'm very used to sort of having people call me honey or sugar or sweetheart, things like that. Those of you that are from the north, that might really bother you. People that say yes ma'am or no sir, sometimes that bothers other people, but that's like what I was around when I grew up. And so none of that actually really bothers me, but there is certain lines that you then become the doctor, and when instead of you being called Dr. French, you're honey or sugar, and there's a little bit where the lines get a little skewed. I'm actually going to start my story in vet school because I think that this is going to relate to what a lot of you are going to deal with in clinics. So I went through vet school. I, like you, had about 20 boys in my class. So my class had 84 people total, and I had 21 boys in that class, and the rest were females. And within each one of our groups, they did kind of try to put one token male in a lot of our groups. And so that was like that one person that was supposed to calm the estrogen down, but it never really worked that way. And I actually was really, really close friends with a lot of the males that were in my class. And I went to clinics with them, so we all would go through our clinical rotations, and I wanted to be an equine practitioner. That is what I wanted to do. So when I got on my equine rotation, I was ready. I had read everything. I was ready to be the #1 A+ student, and I was going to take all the cases. And that rotation was also where one of my male friends, my super close male friends, was on with me. And he got so much preferential treatment that I wanted to scream. And by saying that, to the point where I actually started thinking, I maybe don't want to do equine medicine. Like, I hate this rotation so much and how I'm being treated in this respect so much that I just don't even want to do this anymore. And I think that that's something that you guys are going to see. You guys that are going, you females that are going out, you're going to be in clinics, occasionally, especially for your large animal rotations, you're going to see that boys are going to be preferentially chosen to go on certain calls and to do certain things. And you're going to be like, well, why not me? I'm just as good at this. And to be honest, I don't have a great advice for you other than you just have to stick it out. You're there for your education. You just have to be there. You have to be willing to do anything and everything. You have to not take anything personally when it comes to that kind of a situation. It happens. I will tell you, from being a resident and having situations where I have to choose between a 200-pound guy to come help me move a cow and a 100-pound girl, I probably chose the 200-pound guy too. And I also would have that in my thought of okay, you come too. You come and I'll try to teach you how to use ropes. But it just happens in that kind of a respect. And my advice in a lot of this is going to be rise above. And I've heard some people tell me that, and that's now what I just tell myself. And it's not that you have to really take it super personally. It's just that you have to understand, this is how it is at this moment, and this is what I'm going to deal with. So being a resident and then having to go out and try to figure that out. Having people, this is a real life story. I got out of a truck full of students and me. I'm the driver, okay? Go out to a pig farm. I did a food animal residency, so I did all exclusively large animal all the time. So I would show up and I would have, a boy and 3 girls, and the farmer would come out and he'd be like, hey, and introduce himself to the male student. And I'm like, oh, see, you met my student there. That's nice. And he's like, oh, hi, I am also still that person. It's one of those things that you have to kind of smile through it. You can let that kind of a situation really bug you and set the tone for your entire sort of situation that you're about to go into. Or you can say, oh, it's funny, and we're just going to move right on from it. Even today, here at this school, I've had some experiences where I've been out teaching just a group of either locals or a group of other sort of students in a field situation, and I'll say something and people will be like, oh, I don't know if that's right. And they'll look to Dr. Chaplania, who's the male counterpart in Therio, and he'll have to be like, she's right. And that is really frustrating. And if you notice, my face will usually turn a little bit red, and I'll just be like, I am absolutely right. I have a lot of letters. That's correct. Thanks, buddy. You know, so it's the situations like that. They're going to be super, super frustrating. You're going to have moments where you want to stamp your feet, and I will tell you, in my residency, I actually stomped down the entire hallway. It was like, I am the doctor. It's not going the way to react to it though, right? Like, that makes you really look like the doctor, and everyone's really going to pay attention to you then. You have to do it with as much sort of respect for yourself and just understanding the situation. You have to just rise above and kind of understand, like, that's what's going to happen. Now, I'm in a mostly food animal world. Everything that I do does involve me working with large animals, or pigs and goats aren't large, but they're animals that are outside and can be kind of big and hefty. I will tell you guys, and I tell you in 7th semester when you get to my class, if you are a small person, there is going to be some troubles that you are going to go with. You are going to have that problem with, you're just not strong enough to do some of the things that you're going to be required to do to fix the situation. You can absolutely ask for help. You can absolutely get people to come and help you. There are a lot of ways that you can figure out how to do it yourself. Ropes, winches, you will get incredibly good at figuring out how to get things done in the own manner that you have to. You just are going to have to kind of put yourself in that understanding situation of, I have to ask for help, I have to allow them to sort of, however they're going to treat me, I just need to sort of do the best I can with this situation. And that's going to be something that everyone deals with. I will tell you though, if you're not somebody that's very strong, working out is going to help you. I see that in all male and females, that you need to be able to do your job. You've got to have some strength behind it. You know, vet school, we sit around, we study a lot, we don't necessarily work out a lot. But if you're going to go into a food animal situation, I knew somebody that actually required their associates to go and work out 3 times a week. They got a gym membership with their employment, and if you didn't go, you got written up because you weren't working out and you weren't going to be able to do your job on your own the way that you should have. And that was for male and female, so that will happen a lot. I'm going to turn it over just so I don't take all of the spotlight, and then we'll kind of have like a very open forum after each one of us has given kind of our experiences. So I'm going to turn it over to Dr. Little.
Hey guys, thanks for having this forum today. I think it's actually a really important thing that we probably don't talk about enough in large forums. I think we talk about it amongst ourselves quite often as women in the profession. And so for me, my experience, just to go back a little bit, I am essentially 100% equine in my training. So through vet school, had some interesting experiences, and I would say most of what Dr. French says, I'm probably going to echo. So in most of those situations, you do have to rise above, smile, and just move on at that time. Because at that time, what your priority is your patient, and you need to be able to maintain a professional face, especially if you're in the position of teaching other students, like we so often are in a university setting, in our residencies as interns and those kind of situations. That being said, that doesn't mean that you just have to accept it and take it. You can say things, kind of just to echo Dr. French. Actually, hey, I'm Dr. Little, it's real nice to meet you. So can you tell me a little bit more about the problem? Or for me, more so, I haven't had a student introduced, but I have had clients, when I go out, they bring their animal into me, horse is a lameness exam, whatever it is, they introduce themselves for a while. I just happen to have a male assistant. I've had female assistants, male assistants, either way is fine. They introduce themselves to him. He always was like, poor Steven. He's like, actually, I'm just the assistant. I'm still in school, so this is Dr. Simon at the time, and anything she needs me to get anything I can. So he was actually very conscientious and aware and put the client kind of back in their position. He's like, I don't have my license, it came from a Cracker Jack box, so I was just listening to her. And he kind of made it a little bit like a joke so that sometimes clients truly just don't know. From a client perspective, they really don't know, especially when they get out, they bring their animal, their horse to me, they get out of the trailer, they come in and they see my assistant, who happened to be at the time 6 feet tall and probably 230 pounds, and then there's me next to him, right, in slacks and a polo or slacks and a scrub top, something like that. And so, from that perspective, I guess I can understand it, although we shouldn't assume, right, but such is life. And so that's something that I think if you can make your client aware without, you don't need to humiliate them, and maintaining a level of respect and friendship for yourself, but also for the situation and the client. For me, more of my experiences, I had a few in private practice like that. I also had a gentleman when I first got out, before I did my internship, I actually was in mixed animal private practice in Wyoming before I went back for internship. And so that was a really hard life lesson about how to be, one, a girl in mixed animal practice, two, petite, use that word, and three, young in appearance. I probably at that time looked like I was about 20 years old, maybe. So I had three things going against me when I went on farm calls and stuff like that. And so I literally had a client come into the hospital. I remember very specifically that Kasie had a horse with a snotty nose, wanted someone to come out and see it, and they said, well, the other doc, we'll call him Dr. John, he was not here, he was actually off, and I was the new vet in the practice, and she can go see you. I was there, he saw me at my face. I don't want, now I'm just a little bit redneck, but I don't want no damn girl coming off my ranch, can't handle my horse. And I'm like, all right. So I chose in that situation to just walk away and go to the back of the hospital and do my other things, and let the front desk staff, I'm not going. It's not worth my time to go there because I'm setting myself up for failure. Interestingly enough, I think it was 2 weeks if I remember my memory's not very good, but somewhere after that period of time, same guy has an emergency colic. Guess who's on call? His favorite, right? So there's no options. Emergency service just sends me out. Like, that's who's coming. He can deal with me, or he can have a sick horse, or he can drive it down to CSU, right? So those are his options. So he sees me, and that's where I think some of you can, as a woman, I think you can shatter some of these preconceived notions, right? If you do your job and you do it well. And so for me, luckily, it was a medical colic, so it was something that I was able to treat. I passed the tube without the bloody nose, right? You have to do everything a little bit better, I feel like. And maybe that's just my own impression because of my experiences. But no bloody nose, treated the horse, life is great, called in the morning, super appreciative. They wanted me to come do all their work after that. And that's a true story. So there are ways around that. And this guy legitimately did not want me on his farm to see a snotty nose. Okay. So these things happen, and you just have to find, there's ways that you can get around it by rising above. There are also specific times in my experience that I felt I needed to stand up for myself. And I think that's something that as women, we often don't do very well. Please guys, if you have questions or comments about any of this, like raise your hand, but that we just don't do very well. I think a lot of times we say, oh, it's probably fine, I'm just overreacting. We make a lot of excuses for in my experience, a lot of excuses for other people's behavior that I don't think we need to make. One experience in my residency, I was an equine surgical resident, the only female, and most of my resident mates were all actually internationals, so they were not non-Americans, so different cultures, plus different genders, and it made for interesting times sometimes, and a lot of my supervisors were actually also boarded surgeons, but from different cultures, from all around the world. And so I was told by somebody one time that it was okay, we were doing something, we were scoping a horse, and my resident and I both made the same mistake. And you can imagine how much trouble you get in as a resident if you make a mistake or answer a question wrong in the OR. Y'all think it's bad for you, okay? So we get chastised told how unintelligent we are, and it goes on for a while, whatever. And then we get called into the office later, the two of us, where I'm told, now, Dr. Simon, Little now, it's not so important for you. Like, don't worry, like, it's not such a big deal for you because you have Brady to take care of you. But Dr. Smith, we'll call him Dr. Smith, you need to know this information. You have to have a job, you have to support your family, this is your career. I'm gonna tell you, I did not rise above. Maybe I shouldn't have, and I say these, that was a terrible experience. I still even like bringing it up, you can probably tell like my blood pressure goes up. But I think it's important that you guys are aware that this happens to people still. And this isn't that long ago, 10 years. And so, I was flabbergasted, shocked. I just had never been spoken to or essentially just belittled that way. Like, all my work, like this is my passion, this is what I want, this is what I'm hungry for. I've called my way to the surface, I can answer every single question, almost right every single time, I guarantee it. And to be told that all that work doesn't matter and it's not gonna matter because I'm gonna be married and I don't know, have like 10 kids and be in the kitchen, I'm not real sure exactly, I don't cook by the way. But, so I was really upset and my initial reaction was just shock and I didn't say anything. And then for about 3 days, I couldn't focus on very many other things because I was so upset that this happened to me. And I thought about it, I thought about it, I thought about it, and I was like, I can't just let this go. And I guess there's arguments for letting it go or not letting it go. And I went to that person's office and I said, we need to talk. I said, you might have to realize that I'm not really happy with you. Like, what do you mean? I don't understand, right? Blah, blah, blah. And I said, how can you, I said, you can't speak to me. You're not allowed to speak to me in the manner in which you spoke to me the other day. The man had no idea what I was talking about, okay? So, and I told him, and I luckily had a few days to sort of be able to say the words without expletives and additional adjectives that may not be construed as professional. But I was very clear. I said, you cannot speak to anybody that way. In my personal life, number one is none of your concern. Number two, it's just as important for me to excel in this residency program as it is for any other house officer, and to know my information and to come out of here a good surgeon with good clinical skills and ability to be in a referral practice. And I plan to work, by the way. And there's just no excuse for what you said. Oh, Erika, I'm really sorry. No, that's not what I meant. Like, you have it all wrong. I didn't mean anything. I just meant, it's really just not as important for you. I'm like, maybe that's not petty. And so one of the things for me that was a big learning experience is he truly wasn't trying to belittle me or demean me. That was a cultural difference that he saw that I wasn't going to get past. And so I stopped him and I said, that right there, you can't say that. It's not okay to say. So these are not things that, it's not okay when we're all doing the same work here to minimize my efforts. And he said, no, I don't need to, I would have you in the OR anytime, I refer things to you, I tell people, I know, I understand that. You need to understand when you're speaking to others that you can't do this, myself or students. God forbid it was a student also that this happened to. And so, while he understood, I think, intellectually after that conversation, and I bring that up in such detail because that person really, truly was just a cultural difference, male, female, in their culture, and that you're gonna run into in practice as well. And he understands it now. I don't think he'll say anything out loud because we really had a long talk about it. But I was polite, I was professional, but I was like, hey, this is an issue and we have to continue to work together and you're my boss and I want to learn from you. I think you're a good surgeon, but this is not okay. But I think culturally there'll still be some issues associated with that. So that's a huge thing for me that happened and that kind of taught me to stick up for myself when the situation called for it. And then other times you need to make that decision to rise above, like Dr. French said. And so, and there's several others, one of the things, I'm just gonna go off a little bit of tangent, get me back on track if I go too far. But just like Dr. French was talking about, she makes a really good point about being little and maybe not having the brute force and strength, but I do have the awkwardness, and there are ways when you're small, and granted, I did not do farm animal work, it was strictly equine work, so it is quite a bit different, and the handleability of those animals and what you can do and ways you can finesse the situation. But I have learned a lot of different ways. Some of you guys will hear me talk about this in lecture, in surgery in 7th semester, about what things I do differently than maybe how I was trained, because I've had to work out a way to still be able to unflip that huge colon that's impacted with feed, bend over with my arms in the belly, or hold up and bandage or handle a 1,400-pound stallion or something along those lines. And there's ways you can do that, and yes, you may need to employ some people who are a little bit larger than you. I wholeheartedly agree with Dr. French in working out, staying in good physical shape, regardless, small or large animal practice. I think that's important for your health and well-being. But you're gonna have those same people, like people come up and say, you're the doctor? But you're so little. Or they'll say, you're so young,
How do you handle, like, your significant other is in the same field, working with the same animals? How do you go about,
Line?
how do you go about people, like, always wanting to go to him because he's the male and try to get...
That's a good question, because I think a lot of us meet our significant others in veterinary school or in the industry to some extent. I do think that happens not infrequently. And so I can only tell you my experience from that, and I'm very lucky in that my partner is very professional, and if they are not there to see him, he'll say, you gotta ask her, she's the one that's evaluated this patient. Or the other thing he'll say, because we're different in that he really enjoys general practice, ambulatory practice, and equine reproduction, things that I don't enjoy. And so it works out really well. He can say, you know what, she's the surgeon. I'm out just helping at her assist today. We also would make rules in the beginning that, if I'm the one on call, and I'm getting called in, or if I was usually on secondary call, because things that are surgical, and I get called in, and I thought I I didn't have enough help. As the female, he would be my technician, because I might not be able to get anybody in at the right time, especially if something was far away that somebody else really needed help with. And we just made that rule. And so even though we worked together and there's 2 vets out there, whoever's call that was, and sometimes I'd go help him, and I would step out of my role and just put a different hat on. And be his helper. So a little bit out of the scope, that's how we handled it. I think there's different ways. But as a woman, you're gonna get a lot of these things and a lot of these situations. And sometimes I think you need to, the bottom line is you do need to rise above and decide, pick your battles, I think. And then other times I think you have to, for me anyway, and I think it's a very personal decision. Other times you have to address that person, but just do so in a professional manner that's gonna show you in a good light instead of, and I will say I have definitely thrown my fair share of temper tantrums in the hospital and feel like I'm being ignored, but that's not a good thing, it's, as you grow older, I realize maybe behave a little bit more appropriately. So, and we can take any questions you guys have and stuff, but I thought I'd turn over to Dr. Huck so she can talk to you guys a little bit more about her experiences, and kind of go from there. Are you gonna make some cookies?
That's a pointed comment that she made. So how many of you have read the book Lean In by Charles? Okay. Oh, I can't believe for all of you at this talk and none of you other than Kasie read the book. So it's a really, really good book. There are some things in it that I really resonated with me. There were other things where I was like, So one thing that one aspect of being a woman in veterinary medicine that you're not going to get from the 3 of us is the whole children thing. None of us have children, so we haven't had to sort of handle that battle, which from what I understand can be very, very challenging. But one thing I wanted to mention, I definitely have had experiences like them. You will get it everywhere, no matter where you are. For example, I practiced in New York City and still had experiences like that. So after practicing during my internship and residency in the Midwest and in the South, I thought, oh, okay, I'm going back to New York, and this will definitely not be as common. Still happens, because even if you're not working with a population of people where there might be, some more preconceived notions about what women can and cannot do, and you think you're in a more liberal area, I still had to work with referring veterinarians who would prefer to refer to my male counterparts, even if they had less experience than me, because, oh, well, it's an orthopedic case and you're a girl, so you don't know how to fix bones. Okay, all right. But, above and beyond, this isn't just meant to have the three of us get up here and be, oh, we got put down by people. Obviously, we've been very successful in our careers. But something I wanted to mention to you is, going back to the book Lean In, is she touches upon a number of studies that maybe you've heard about where they take females and males and present them with CVs or resumes, and they blind these CVs. So they take the same CV and they put a woman's name on it and a male's name on it. And for the most part, the male CV, which is exactly the same in terms of experience, is always rated more favorably, not only by men, but also by women. And this study has sort of been repeated in various ways over and over and over again. So what that tells me is that not only do we need, we need more support from our male counterparts, but we need to be more supportive of each other as well. And I think that hopefully you guys are starting to learn that in veterinary school, which is very, very competitive. Somebody else's failures should not be your successes, all right? Not only that, but we should not be feeding into stereotypes that are out there already about women and how they should be and what they should and shouldn't be doing. So from my own personal experience as a surgeon, oftentimes, I'm getting asked by emergency doctors or other non-surgeons in practice about how to do things, or they're asking for consultations. Well, just like anybody else, I want to be able to do my job best. So when I ask questions back, or when I ask for certain information, that's not me being mean, or that's not me being rude. That's me needing more information to do my job so I can help you and your patient. Well, unfortunately, that oftentimes gets perceived as being bitchy, being demanding, asking for too much, not being a team player, all right? And that is absolutely something that people, I don't know, have you experienced that, Dr. Little? Yeah, and I'm sure Dr. French has as well. And it's really just comes from a place of wanting to do your job the best. And what makes me really sad about this is that oftentimes those comments are coming from other female veterinarians, not males. And they look at behavior that I exhibit, which is professional, and behavior that my male counterparts may exhibit, which I had male counterparts that would throw instruments in an OR. They would knock things off tables. That is not considered unprofessional to them. Those doctors did not get comments made that they were being mean or obstructive. So, we need to be very cognizant of how we're treating each other and the expectations we have. If I'm standing up here without a smiley face, it doesn't mean that I'm a mean person. Versus a guy could do that and they look at that as being very serious. I've had student comments in my evaluation saying, well, she's not as smiley as she should be. I'm a pretty smiley person in general. And I asked Dr. Pope and Dr. Dunst and Dr. Tams, do you get comments about your lack of smiling? Nope, not one. So, I don't want to get into a lot of examples. I've been told to bake cookies for my referring veterinarians. I've been told, well, you're just not as memorable as your male surgeon that you work with, so you really need to do more, hence the baking. And those are things that can enrage you, all right? And you need to think about what you want to do about that. So how can you go about changing the culture? So we have this culture that might exist. What can we do to change it? It's the small things. Don't perpetuate the stereotypes, all right? don't feel like you need to change